Hello, everyone, and welcome to the next module in our series of industry insights. In this module, we will try to decode the basics of the MLR review. MLR review is in the internal review done by your medical, legal, and the regulatory teams. So, for many of us, it is a pain point because the MLR review would mean endless cycles of revisions. There may be instances of conflicting feedback from the different teams. There may be some comments wherein some vague comments like this is too promotional, wherein you are not very clear how to handle those comments. And certainly all of this leads to delays in the project timelines. So MLR process many a times would feel like a bottleneck where great content from your end is going in and chaos in the form of multiple reviews from different teams, multiple reviews having different perspectives. So in a way, a chaotic output coming out. So certainly it would be a source of frustration and the project delays. However, what I would try to stress upon is MLR review as a process is not a hurdle. Rather, if somehow we modify our approach, it can certainly become more streamlined, and in fact, it can become a way more helpful to us. Okay, so first and foremost thing is about changing the mindset. We have to understand that it is not our adversary, it is an ally to us. Because at the end of the day, it is trying to make your content more tighter, more concrete when it comes to the review. So, see, this mindset which says MLR review is a hurdle I have to get over, this has to go away and it has to be replaced by MLR is your expert partner in ensuring the compliance. It will certainly protect the company, the patients, and most importantly, your work. So it will give your work the safety net which it requires. So as I mentioned, MLR stands for M as in the medical partner who is reviewing your content, the scientist. His focus will be on ensuring the clinical accuracy, fair balance, and data integrity, data accuracy in your content. So his comments will be focused on these aspects. Now coming to the legal will talk about risk mitigation for the company as a whole, right? So it will, if by chance, if by mistake you have gone ahead with off-label promotion, the legal feedback would catch it up. And then coming to the regulatory, in a way it is the rule keeper. So it will give comments related to the adherence to FDA, EMA, and in India, UCPMP guidelines and codes. So you will get an umbrella of comments from these three reviewers covering their own area of expertise. So what should be done? See, from my experience, what I have realized and what I would also suggest is to is to follow a three-step, rather three-phase framework. Okay, so even before you go ahead and submit your document for MLR review, go for a pre-submission because it will, if your foundation is strong, if few mistakes or gaps or loose areas get picked up at the pre-submission stage, then nothing like it. It will streamline the entire process. And then content. Ensure that while you are drafting the content, you are sticking tightly to the compliance guidelines. Certainly, these two phases are, if you are trying to make these two phases as error-free as possible, the third phase of the outcome would certainly, the finish line would certainly be far more easier for you, right? And try to also in the third phase, when you are actually submitting the document for the MLR review, whatever review comments you are getting from your partners, the ML and R partners, try to incorporate them in a very streamlined, in a very coordinated manner. We will talk about it. So let's start with the first phase, the power of the pre-brief. Generally, we skip it because many a times it happens that we are given tight timelines. So to match those timelines, we go ahead and directly draft the content and submit it for the MLR review. However, my suggestion, try not to skip this first process. Create a one-page MLR pre-submission brief. Brief would it is like a cover letter. So it will have the objective, it will have the audience, it would have those 1 to 3 core messages which you are going to cover in your document. And certainly uh, do include references, because once you give references, it gives the confidence, it gives the other person the confidence in your document. And then once this free brief is ready, circulate it among all the stakeholders, get their approval on that document. Even this would in fact give you a better clarity. Many a times there may be in the objective, it's very human. Now, out of 3 objectives, you may not have understood one objective clearly. So once you get their perspective on this pre-brief document, you will get clearer on the requirements. And then align. So in a way, you yourself have to get aligned, and you have to align the team on the strategy before you create the content. So this would be your ultimate pro move. Now coming to the next phase, writing. So when we talk about writing, first and foremost, reference everything, annotate everything. Every claim, especially the data point, must be linked to a specific highlighted reference. A fair balance. Fair balance would mean even if a drug has 7 is efficacious in 7 conditions, there may be, and even if there is a single adverse effect, side effect, you need to document that side effect uh, along with the drug efficacy. So everything needs to be documented transparently. The language should be very clear. No need to make it, no need to go ahead and write a novel. Stick to the data. Your data will speak for itself, right? And ensure graphs are clear and not misleading. This has to be done. Yeah. Please do not truncate the y-axis. Now coming to, if we talk about annotating. So as we have covered in our other modules also, this is one of the foundation steps for a medical writer. Annotate whatever you are writing, right? So if it is about this claim, like drug X demonstrated a 54% reduction in symptoms, which was statistically significant, the perfect annotation would look like this, right? Exact page number, if possible, even the table number, because this will tell your reviewer, it will save his time, it will give him the confidence in your data. So please annotate everything. Now, once you have written the document, first and foremost, give a pre-brief. Align all the stakeholders. 2, while drafting, while compiling, while synthesizing the data, annotate everything. Now, when it comes to responding to those comments which you have received from all the 3 teams, first and foremost, about the mindset, they are your they are your team, which is trying to improve the content, which is in a way trying to provide you the safety net for the saving you from any troubles later on, right? So don't, yeah, be very professional. See, if I write simply done or accepted, try to use write simple sentences. However, they should look complete and polite enough. Comment like instead of a simple done or accepted, go ahead and write comment accepted, updated. The text is requested to improve the clarity, because this will show that you, it will give the other person a feeling of being a team, right? And if there is a point wherein you disagree with the comment, then it should be presented very properly, like comment noted. My intent was give your data, along with the data, give the reference point, and then maybe you can ask for a discussion on that particular comment. So be professional, be humble, and be responsive, be receptive. That's it. Now your role, yeah, there may be instances when there are conflicting comments. So herein your role will, from a medical writer, it will change to a strategic mediator, right? So for example, if medical and legal are disagreeing, so first thing you will have to acknowledge the conflict by stating the issue clearly and objectively in the comments. Okay, so thank you both. And see, both of them, both the medical and the legal reviewers would have their own perspective. So none of them can be completely wrong. So if medical would be talking about specificity, legal's concern may be about the risk, right? So you have to analyze this, and then you have to propose a third way, because you are the connecting link. So you would be the one offering a new solution that would be a midway. And then if needed, you can arrange a quick call, because as we all know, this is the basis of the communication. Rather than texting, go ahead and talk. So, I mean, this was a very brief, about a very brief introduction about the MLR review. Just to summarize, you should be a partner. There should the mindset is the game changer, and pre-brief is a very essential component. Uh, if you are annotating every single data, it will help you a lot. And you have to be a mediator at times. And whenever it comes to communicating, be professional. Thank you. Looking forward to have you for our last session, which will be on the medical science liaison. Thanks. Have a great time. Bye-bye.